Ladies and gentlemen, welcome to the Acronis virtual conference, the COVID-19 outbreak, what to expect and how to stay cyber fit. I'm your host, James Slaby. I'm the Director of Cyber Protection at Acronis, and I have just a few housekeeping announcements before we get started. This conference is being recorded, and we will email you a link to the recording after it's over so that you can share it with colleagues who couldn't attend. Your microphones are going to be muted throughout the event, but you can submit questions through the Zoom Q&A interface. We're going to get to as many of those as we can on the air today. Those that we don't get to, we will also follow up with you. So if you submitted a question and didn't get an answer, you'll get one after the event. So we have a terrific panel of experts on hand today and a packed agenda, so let's get right to it. First up, we'll have a renowned vaccinologist, immunologist, cell biologist, and microbiologist, Dr. Rino Rappuoli, who will share his views on the COVID-19 pandemic, the efforts to develop vaccines for it, and some likely future outcomes over the long term. Next up, we'll have Acronis founder and CEO Serguei Beloussov, who will discuss the recent transformation of Acronis operations for our own business continuity and how we continue to serve our partners and their customers in the wake of the pandemic. After Serguei, we'll have Candid Wuest, who's the Vice President of Cyber Protect Research at Acronis, and he will offer some best practices on how businesses and consumers can successfully secure their work from home environments in this fast changing new reality. At the very end, we'll have a panel discussion with these three science, business, and technology leaders. It's now my great pleasure to introduce Dr. Rino Rappuoli, who is the Chief Scientist and Head of External Research and Development of GlaxoSmithKline Vaccines and Professor of Vaccine Research at Imperial College London. He previously served as Head of Vaccine R&D at Novartis, Chief Science Officer at Chiron Corporation, and Head of R&D at Sclavo. He earned his PhD in Biological Sciences at the University of Siena, Italy, and was a visiting scientist at Rockefeller University and Harvard Medical School. Rappuoli is a member of some of science's most prestigious societies, recipient of many of its most coveted awards, and the author of 700 peer-reviewed research papers. He pioneered several groundbreaking scientific concepts, including genetic detoxification, cellular microbiology, reverse vaccinology, and the pangenome. He developed new vaccines for several deadly diseases, including pertussis and meningitis, and founded the GSK Vaccines Institute for Global Health. We're very grateful to have you share your industry-leading expertise on this very urgent subject. Over to you, Dr. Rappuoli.
Hi, thank you, James, and hi to everybody. Let me start introducing my talk saying that although I'm Chief Scientist at GSK Vaccines, the views I'm going to present today, they are my personal views, not necessarily represent the views of the company. And I will start my presentation by just introducing you to, with this first slide, with the coronaviruses. As you can see, there are plenty of coronaviruses in our planet. They colonize all type of animals, from dogs to cats, pigs, birds, and so on. And they are all coronaviruses, they're all viruses that can they colonize all these animals. As you can see in the left of the slide, there are two viruses that are normally colonize humans. These are human coronaviruses that cause a common cold. Nothing, I mean, they're with us all the time, nothing special. Then there are in the middle part of the slide, there are two coronaviruses that emerged during the last 20 years. Both of them come from bats. One caused SARS in 2002, and the other one caused MERS, Middle East Respiratory Syndrome, in 2012. So in 2002 to 2012, this coronavirus from animals jumped into humans and caused a pretty severe disease, a respiratory disease. And as you can see in the slide, there are plenty of other coronavirus out there that can do the same. If I can go to the next slide, that's what happened. Sorry, the next slide tells you the work we did back at the time, so 2002, when SARS occurred. At that time, we looked at we isolated the virus, and you can see the real virus seen in the electron micrograph on the left, and you see the kind of corona that surrounds the virus. And on the right, you see the scheme of the virus. On the next slide, you see what happened recently. The COVID-19, which is a coronavirus, which is has a genome of 30,000 bases, is related to bat coronaviruses, as homology to SARS, 79%, and to MERS, 50%. This coronavirus basically in Wuhan jumped from probably bats into humans, and in humans had what we call is very infectious. Had a reproductive number of 2.6, between 2.6 and 4, which means that every person will be able to infect between 2.6 and 4 other people. And basically in 3 months, this virus was able to jump from Wuhan to the rest of the world, in the right of the slide. And you see that today we have almost 2 million cases, 126,000 deaths, and a spread in 185 countries. So that's the way this virus came. We didn't know about him 3 months ago, and now it's everywhere. The next slide shows the kind of disease this virus causes. As you can see, on the left, you have the infection. And at the beginning, the first few days is asymptomatic for 1 or 2 days. Then starts with fever and a lot of viral spread. And this is causes fever. Most of the people will have the virus growing in the body at this time. And usually the virus then in 10, 15 days goes away. That's what happens to most of the people. There is a second phase that happens in a subgroup of people, mostly elderly, where basically the immune response basically to the virus takes over in the lungs. And you have a big inflammation, severe inflammation that takes place in the lungs. And the immune response causes the pneumonia and basically makes the disease very severe. And in many people can become critical and people may die. So there are 2 important parts in the infection. The first one caused by the virus that basically grows, causes fever, and is mild. And then the severe part, which is the combination of the immune response and the virus that gives pneumonia. In the next slide, you see the mortality. This is the numbers from Italy. And you see that basically disease in the left, in age groups up to 50, 59 years of age, the disease is pretty mild, mortality is very low. But when you start to go to 60, 69, 70, and 80 years old people, mortality becomes very high. The number of severe diseases increases a lot. And basically the late severe cases and the mortality is due not anymore from the virus itself, but by the immune response to the virus that takes place on the lungs and causes pneumonia and the cytokine storm, and that causes very severe disease. So that's how the virus came, how the type of disease, and the mortality that it causes. Next slide shows you what we can do today for this virus. Basically, we have no drugs, we have no vaccines. So the only tools that we have to reduce the infectivity of this virus are very old. They are quarantine, social distancing, and hygiene. why do we have these things? The next slide shows you, on the left, you see the theory. You see on the left two peaks. The first one is basically without any intervention. You see a big peak on the left. What would happen? This will be severe disease that would happen if we didn't do any intervention, if we didn't have an intervention in terms of quarantine and social distancing. Basically, what will happen is that we'll have an incredible number of people that will be hospitalized and will saturate the hospitals and the capacity of the hospital, which will be the dotted line below. And basically, people will die just because they don't have enough respirators in the hospital and enough support. In the lower curve, you see what will happen with social distances and quarantine. Basically, you dilute the same cases over time, and basically you don't saturate the hospital intensive care, and you can manage these cases and much less people will die. An example of this theory is what happened in Italy, which has been one of the countries being hit the most after China. What you see there, you see two maps, scenario A, which is what happened, scenario B, what was going to happen without intervention. And on the far right of the slide, you see an arrow, a red arrow, that indicates the number of cases of people hospitalized in Italy, which were a lot of people, but above that you see one dotted line, two dotted lines, and those indicates what was going to happen in Italy unless we had introduced social distances and quarantine and basically shut down any mobility of the people. So by the lockdown of the country, we were able basically to reduce enormously the number of hospitalization and mortality. Next slide shows you that the social distancing and quarantine, they do work. China is a good example. There's a yellow line. Basically has been able to eliminate the disease, basically, or the infection by doing that. Next slide shows you, in order to plan how to address that, you need modeling. And you see on the left what the model was done for Italy. In Italy, was predicted that the infections will go up, will reach a peak in March 18, and then will go down. And on the right, you see what happened. On the right, you see that the peak indeed was reached on March 21, thanks to the lockdown. Then things started to go down. It's not going down as fast as predicted in the model, but it's going the right direction, just a few days of delay. So it is predicted that in Italy will go down, and the lockdown and the measures introduced by the government are actually working. Next slide addresses what we have in terms of drugs. There are a lot of drugs that people are proposing all over the media, and some people say they are miracle drugs. Well, there is no evidence that any of them is really actually working. And so none of the drugs are really approved by the FDA or other regulatory agencies. And the only one for which there is a published paper that has some credibility is the one on the left, which is basically remdesivir from Gilead. This one has been used for compassionate use, so there's not really a way to establish how well it did work. But basically in this publication, they say that 68% of the patients got some improvement because of using the drugs. There are no data, really credible data for any of the others, although there are many, many people who claim they work. There are usually, there are no studies. Those studies will come in the near future, but for the moment, it's difficult to say anything about all the other drugs, and nobody is able to recommend them. Next slide shows you what we're doing about vaccines. Basically, there are three types of vaccines that are being developed. One is our vaccines on RNA. These are synthetic vaccines derived from the genome of the virus, and where the synthetic genes are basically just injected. These vaccines are going to, very likely are going to work, but they're very immature. There is no licensed vaccine based on RNA, and very new technology, may or may not work. We know a little bit about the safety, but not too much. So very innovative, they're very fast to develop. The first ones to they went into clinical trials, but we'll need to wait and see whether we can make, they will work or not. The second one are those based on viral vectors, where a synthetic gene is spliced into a virus, like can be adeno, chimp adeno, measles, vesicular stomatitis virus, and so on. And these vaccines, there is one vaccine based on this technology, which is the Ebola vaccine, which has been licensed last year, is more mature than RNA, but still very little experience with these vectors. So we'll need to, there are several in clinical trials, so we need to wait and see whether they're going to work or not. And then we have the traditional protein-based vaccines. These are based on recombinant proteins that are made using the synthetic genes, which has been expressed in mammalian cells or in baculovirus or other. And these vaccines usually need an adjuvant, but we are pretty sure these vaccines are going to work because we have a lot of experience with protein-based vaccines plus adjuvant, with influenza vaccines, with respiratory syncytial virus vaccines, with many different vaccines that have been based on this technology. So basically, I believe these are the vaccines that are going to be developed. And if we're going to need hundreds of millions of doses of this vaccine to fight this pandemic globally, this is the technology we're going to use. Finally, about the immunotherapy, I mentioned also human monoclonal antibodies. This can be produced starting from memory B cells derived from convalescent people. You can make plenty of human monoclonal antibodies and give it for prevention and for therapy. And these are a pretty new technology for infectious disease, but very established in cancer. And so it's a pretty mature technology, which I think will have will be important for therapy in the near future. Next slide tells you a little bit more about vaccines. I'm pretty sure you have seen a lot of claims worldwide that a lot of people are working on vaccines. Well, there are more than 100 different vaccines being developed. Most of these vaccines have been developed by groups that are not going to go very far. And basically, what you see here is that once you have developed a vaccine in the lab, you have done 10% of the work. Most of the work, the 90% of the work is necessary later. So this involves clinical trials, industrialization, and so on. And so I think the most important thing has to come, and you will need big companies with large manufacturing capacity available in order to make these vaccines. And you probably have seen in the media yesterday and today that Sanofi and GSK made an alliance to use their manufacturing capacity of adjuvants and proteins, basically to make a vaccine available in the hundreds of millions of doses globally. Next slide is my last slide. Basically, it's going to talk about the future. What's the future? Well, there are three scenarios. One is a scenario we would like to have, but it's very unlikely, is the one to have no more COVID in the future after the summer. The other one is that COVID will be there, will be endemic, and we'll have a second wave of infections. But basically, those will possibly come with vaccines, and we'll have vaccines and drugs and therapy, and we'll be able to cope with them. And the third scenario is that COVID becomes endemic, but may mutate every year, and then we'll have to make vaccines every year, new vaccines. I think this last scenario is unlikely, so my preferred scenario is number two, where this virus will be around for a while, but we'll be able to cope with it through vaccines and therapeutics. And with that, I would like to thank you for your attention.
Doctor, thank you so much for that presentation. Your expertise and clarity is most welcome and urgent at this time. We really appreciate it. We've got a lot of questions from the audience. I know we're not going to be able to get to all of them today, but I'd like to at least bring a few to you, again, with our commitment that we will follow up with our audience with questions that were asked but not answered today after the event. So let me start with question number 1. How is your collaboration with CEPI, I believe that's CEPI, and Clover Biopharmaceuticals going on the development of a vaccine?
Well, what we did, we decided basically to make our adjuvant available to every group in the world that has a credible vaccine development plan. And Clover is a Chinese company that had a good protein-based vaccines. They needed an adjuvant, and we made the vaccine available, the adjuvant available to them. And the collaboration is going extremely well. I think it's moving forward. And as soon as the data will be available, it will be shared.
Thank you for that. What precautions did you make for your own family? Drugs, masks, isolation? What have you actually done for you and your loved ones?
Well, we basically follow the guidelines and which is basically social distancing. So we live with the family in our house in the countryside, and when people are closer than 1 meter, we wear masks. When we are most distance, we don't. And basically, we follow the guidelines that are made by authorities.
So one more question before we move on to the next session. Are cured people becoming immune, and should we try to reach herd immunity?
It's too early to say whether cured people become immune. My expectation is they will be immune, but there's not been a study that's been able to confirm that. So very likely yes, but we need to wait to have the final answer. The herd immunity will be very nice to have because then we'll not have problems with the virus anymore. The problem is how to achieve it. If you want to achieve without any measure, that will basically cause to the world millions of deaths. Because that means that the virus has to spread freely, and you will saturate all the hospitals and people will die in a massive way. So achieving herd immunity just by doing nothing is not a good thing to advise. Achieving herd immunity by vaccination is the one that I would recommend.
Thank you again for your presentation and your answers, Doctor. I hope you can stay around for the panel discussion at the end. At this point, I would like to introduce the boss. Serguei Beloussov is a Singaporean national, self-made entrepreneur and business executive with an outstanding 24-year track record of building, growing, and leading high-performing multinational tech companies in North America, Europe, and Asia. Recognized as an innovator and thought leader in the fields of virtualization, data center automation, and cloud computing, he's a frequent speaker at industry events around the world, like this one. On top of filing over 200 patents, Serguei holds a Doctor of Science and PhD degrees in computer science, an honors Master of Science in physics and electrical engineering, and an honors Bachelor of Science in physics, all from the Moscow Institute of Physics and Technology. He's the founder and CEO of Acronis, the global leader in cyber protection, and somehow finds the time to continue in leadership and investment roles in tech venture funds Rino Capital, Q-Wave Capital, which is focused on quantum technology research, and Almaz Capital, tech vendors Parallels and Acumatica, and Swiss research institution, the Schaffhausen Institute of Technology. What I would do just for his time management skills. Today, he will talk about how he has led Acronis's business transformation in response to the pandemic. Over to you, Sergei.
Okay. Thank you very much. One thing which is great about track record is that you don't need to do anything for the track record to actually add on. It is actually not 24 years, but 28. And if you wait 1 year, it will be 29, unless I die. And then it will be 30, and then 31, and 32, and 33. So I'm not so sure it's a good thing to have too long of a track record. In any case, talking about Acronis, Acronis is a company which is a leader in cyber protection, AI-powered cyber protection, cyber cloud, and cyber platform. That's the shortest way describing what we do. We're Swiss Singaporean. We are growing rapidly and accelerating this year. Our plan is to grow over 50%, and we're not changing targets yet. And the fastest part of our business is a new business model focused on service providers, which we call cloud business model. We are very, very global. We are in many, many businesses, in almost all Fortune 1000 businesses, and we do business entirely through partners. And our global presence with 1,500 employees make us really feel the pain of this current pandemic. And just to show how this looks, oops, sorry. This is how the situation looks in our two headquarters. The two countries, which are generally very similar in the way how they act about the business. Both countries are about technology, about education, about being open, but very different number of cases, very different percentage of the population actually tested positive. Very different percentage of those who tested positive ended up dying in Switzerland and Singapore. I'm talking to you from Singapore. Nevertheless, Singapore has such a small number of cases relative to other places. I'm still in my apartment, lockdown. So we, as a Acronis, we protect the digital world, and digital world needs protection because the digital workloads are very, very fragile. And there are these 5 challenges to protect it. One of the challenges is complexity. There are over 50 billion devices to protect today, 500 billion by 2030. One challenge is cost. There is a lot of data and a lot of devices, and so the cost per device for protection and cost per gigabyte for protection has to be low. Security, definitely a major problem. Everything is being attacked. Cybercrime is industrialized. Privacy, something which is very, very dear to us, and it's very, very clear to the world since about 3 years that it's a major problem, especially clear today. A lot of the issues which happen with number of remote workplace applications today are not really related to security, but related to privacy. And another very subtle issue, which was happening to IT over the past maybe 30 years, 20 years, 10 years, everything which been talked about by IT leaders, but IT is really becoming something which we cannot live without. And so protecting IT is a 5th basic need. You need water, you need air, you need food to survive. You actually need shelter. There is no way to survive long-term without shelter. Try to go to places which are extreme, either extremely hot or extremely cold. And now you also need protection. It's especially clear today. All of a sudden, IT people are under a lot of stress because of this major challenge that IT must operate. If in the past, if IT was down, we would be less productive for a while. Today, people are confined to their homes, and if IT is down, it is not clear what happens next. Without IT, we cannot have any conferences, we cannot call each other, we cannot communicate, we cannot order food, we do not know what's happening. It is really mission critical, and this is a completely different challenge for IT professionals. And in Acronis, since about 5 years, we are pushing this concept, Acronis Cyber Protection, which is an integrated way to protect all data applications and systems in such ways that there is a reliable copy for every piece of data, so nothing gets lost, everything's accessible at all time. All of the access is controlled, and you know who access what. You can take back and give the control rights. It's authentic, so you can be sure that the data and application and system is original and it's secure. And all of it is offered as a single application, single user interface, single policy, single technology, and single business package in such ways that it's very easy to use, very low cost, very secure. You keep the full control and it works at all times. Which is especially important for today's world of remote workloads. Remote workloads are mission critical for global economy. We all hope that global economy will open in the next 2 weeks, 2 months, but there is a possibility it will take longer, and there is a possibility it will repeat again, and there is a possibility that when even it open, remote workloads will continue to be very important. And with remote workload, if something is lost, you cannot work. If you cannot access your data application or system, you cannot work. If you are at home, nobody knows who has access to which data, to which application, which system. You make all decisions based on digital data, on digital voice, digital video, digital document, and there is no perimeter of protection at your home. Most of the time, home was outside of the focus of corporate IT, and even when the executives connected, they were not protected. And I think it's, and especially now for most of people connected to this call, which I believe is our partners, it is clear that there is a very much an analog between biohazards and digital hazards. And in both cases, you need to do prevention. Prevention is most important. The reason why we have so many people testing positive and sick with coronavirus is because we did not do prevention. We did not have the measures for hygiene. We did not do vaccination against this virus. We didn't know it's going to happen. We did not measure and catch people who were actually sick. The same thing happens with cyber hazards. You need to do detection. Again, another thing which became entirely clear with this biohazard of coronavirus is that the countries which are able to do detection very quickly can react very quickly, can isolate the people who are testing positive, can find all of the people who are testing positive around them and prevent the spread of the virus. You need to respond very quickly. If you can respond very quickly, many less people will suffer, many less hours will be spent in the hospital, many less people will actually get into intensive care, many less people will die. And again, that's very similar with the cyber threats. You need to do recovery. Recovery is a major issue. It takes time to recover from coronavirus. One of the dangers of coronavirus, and unlike in the cyber world, there is no magic button which you can press and immediately recover. It takes weeks to recover. Some people are sick with coronavirus for, say, 4 weeks or 5 weeks, which is, again, another thing which is very different between this virus and conventional flu. And another thing which is also very clear is you need to do forensic, because the only way to stop the subsequent waves or to stop the spread is to be very clear where people are getting infected. And that is what we are making possible with cyber threats. And that is something which should be very clear to everyone now that it's important. So just to give you an example of what is cyber protection for remote workplace and why it's so important for service providers. First of all, remote environment is typically home environment. It's unsecure. There is unsecure, relatively basic device. There is many devices on the network, even in case the work computer is relatively well configured. There is many devices which are managed by somebody. There is many household members who don't have security skills, who don't have IT people taking care of them, especially children. There is many devices which can actually come from corporate networks and compromise the networks of the home networks and compromise the corporate networks. Now, remote applications are not designed to actually work on unprotected environments. Their applications, they run on the application level. They do not expect that they run in the environment which is full of threats. There is many home environments are connected to a single session. I can see that this session at the moment has 837 participants. The maximum number of participants we had recently on one of our internal town halls was over 1,000. And so some of those networks could be unsecure, and there is multiple unsecure networks at the same time. There is no security training for people in such environment. People are typically do not expect that they need to secure themselves. And there is no corporate IT at home enforcing it. And this is just example what can happen with a typical productivity application like Zoom. You can inject messages into Zoom. You can insert code into Zoom. If you hack into PC, you can hijack the remote control. You can manage the session, and you can do many, many other things. The good thing is for our partners, which again, I believe majority of people who connected to this call, we provide an integrated, complete protection for this remote workload from the standpoint of safety, accessibility, privacy, authenticity, and security, so you can make sure that it works. It protects the workload. We also are now actively working with providers of collaboration applications to protect specifically the applications and to be application aware in this protection with many companies like Zoom, like Microsoft, like Cisco WebEx, like Citrix, LogMeIn, like some collaboration tools like Slack, and this is upcoming in many of our products, and protect remote sessions. And it's very important that this is a solution which allows large number of workloads to be supported by a single technician. Because it's a single solution, it's real easy to protect many networks. Think about how the situation changed. In the past, you have a service provider supporting a small business with 100 employees that would maybe 3 networks in 3 offices. Most of the time, it will be 1 or 2 offices. Now, suddenly, this 100 employees become convert into 3 plus 100 networks, 103 networks, which is much harder to control. Your personnel must be overloaded with requests, and exactly the product like CyberProtect helps it. So again, what CyberProtect does is proactive protection, active protection, and reactive protection. So both vulnerability assessment, patch management, and configuration management, memory, malware prevention with variety of different tools, and reactive protection. When something actually happened and we were not able to help immediately, you can recover and you can understand what happened. It has these 2 unique features which you don't have in any other product beside the integration between our products in protection. Cyber Notary, which allows you to sign digital documents and sign the data to make sure that these documents are not compromised, and you make a decision based on the correct document, and you can check it at any time. And we also provide a very strong control over privacy. We protect your environment, we protect your IT, we protect your business, but you can always understand who has access to your data, which is, again, sounds subtle, but which is very, very much unique feature. Even with the recent challenges in the protection of some of the remote applications, you must have noticed that privacy is a main problem. All of this we put into the package, which is serviceable immediately by service providers, which we call Acronis Cyber Cloud, which allows service providers to very effectively launch protection services, a range of protection services. The most complete is Acronis Cyber Protect, but there is less so Cyber Backup, Cyber Files, and components of Cyber Protect for your customers. And it includes all of these components, which allows you to run profitable and growing business, well integrated with the rest of your business. So real easy, real profitable, and a real good service for your customers. That all of this is based on Acronis Cyber Platform, which is another unique part of our offering, which allows you to extend our cyber protection and our cyber cloud to fit precisely the needs of your business as a service provider, or to fit precisely the needs of your customer. Whenever there is a feature missing in our cyber cloud, which may be useful for you to automate better, or for in a cyber protect, which may be useful for you to protect your customer better, you can edit. There is a number of third parties on cyber platform, and you can also go through Acronis cyber training and get your developers to build the required functionality, whether it's a basic script or more. That we also couple with Acronis Cyber Services and Cyber Academy, which actually is designed to make Acronis products and services much broader for you. You can train and certify your staff. It's all online, and it's all possible immediately right now. In fact, we increased our investment in Cyber Academy by the factor of 5 right now. So we have 5 times more people, and we intend to build several times better and several times more courses on cyber protection and on running cyber cloud and doing service provider business, and on also building services on top of Acronis cyber platform. So this is what Acronis is. I mean, the way we look at the current world is every challenge is an opportunity. That is perhaps one thing which is only result from my 28 years track record, is that every challenge must be an opportunity. There is no other way to look at the challenges. And the good thing about Acronis, we believe we're built for remote work from the beginning. Even before this crisis, we were on 33 locations. Many of our employees work remote. More than 90% of our employees had remote team members in their teams. We also work with service providers, and service providers, most of the service providers have remote employees. Some of them never had offices. Many of them and most of them never met their customers in person. They talk to customers and deal with customers and manage them remotely. We also believe opportunity is growing. There is more workloads right now because there is many more remote workloads, which are doubling the workloads in the office. There is more new SMBs because many of the people who are unfortunately losing jobs right now are actually founding new companies, and they need IT. Without IT, they cannot go forward. There is many service providers, and we believe we can get higher market share for service providers because exactly service providers are the ones who can manage such a complicated and such a cost-sensitive and such a service-sensitive environment, like environment of very distributed and remote workloads. And we also believe that cyber protection should have much higher touch rate. So the opportunity is growing. Our products are very easy and high margin for service providers, very, very efficient and very secure, which is exactly what is needed today. Service providers and customers need to focus on their core business. They don't have time to deal with anything which works less. And that is evident by our strong results. The first quarter, we are 100% and actually above the target for our cloud business. The cloud business grew 88%. So if you think about slowdown in economy when you're growing 88%, that is doesn't really matter if you grow 83% or 91%. So economy may be slower, but there is a huge opportunity for you. And so we think there is exciting future coming. In the next months, we are releasing Acronis Cyber Protect. We are releasing Acronis Cyber Platform. And when putting more effort in it, we are putting much more effort into remote workloads, into integration with applications, into partnership with vendors like Microsoft, like Zoom, like Cisco WebEx, like Citrix, supporting VDI, supporting collaboration applications, supporting the home networks, and so on and so forth. And so more announcements are coming. We are definitely extremely open to the feedback, and much more in Acronis Cyber Academy. With that, this is what we say to our employees, and this is the same what we want to say to our partners. So what can you do now? Well, really there's 3 things. So there's 5 things. So first, stay healthy and stay alert, maintain healthy habits. Do not panic. And the second thing, pay attention to Acronis Cyber Protect, which is now available, and Candid will talk a little bit more about it. The third, pay attention to Acronis Cyber Academy and go through trainings and certifications. It's a good time now. It's a good time for you. It's a good time for your employees if you are a proprietor of the business. prepare and continue to improve your remote workplace. I'm constantly improving mine. It seems that the world is now going to be remote, and there will be many more people working remote. Perhaps right now, number of remote workloads went up by 100 times, but I think even after the crisis will go back, you will still have 10 times more remote workloads than before, and a lot of us will do a lot of things remote. And the last thing, which is extremely important, which is what we tell to our salespeople, to our marketing people, to our partners, to our distributors, is this is really primarily a crisis of economy. It is a crisis in terms of biohazard. Some people will be sick and feel very, very bad. It's not a pleasant sickness at any age. Some people will die, but much higher challenge it is for economy. And so the best thing you can do for yourself, for your family, for your friends, for people around you, for your partners, for your customers, is to continue to be focused on your business, continue to be making money, continue to try to focus on industries and on regions where everything is working. With that, I wanted to remind you about some things which Acronis does beyond normal business, which is Acronis CyberFit initiative, Acronis Cyber Foundation, specifically building schools, and we are actually adding bio and cyber hygiene for the schools we built. So far, we built 8 schools. We intend to continue building schools this year, especially in the time of crisis like this. Without education and knowledge, we cannot sustain the crisis. Dr. Rino has mentioned that the main hope for this is having vaccine, because actually going through herd immunity otherwise is very dangerous. There are 8 billion people in the world. If 6 billion of them will have to get sick and get an immunity, we're talking about not millions, but tens of millions of people dying. And that is too much of a cost in a variety of ways for the humanity to afford. And so you get to solve it through science and knowledge. We have other foundation activities. We are going to continue to support CyberFit sports, and at this point, what we're trying to help sports with and other suffering industry is to help them with virtual events. You will see more virtual sport events, including virtual events in such conventional sports like soccer. And we will continue to make all of our products CyberFit, all of our customers CyberFit, our partners CyberFit, and we are fanatical about CyberFit. And with that, we also will continue to push forward our Acronis CyberFit Dragon with 5 heads, which represent our commitment to our Singapore headquarters, which is probably one of the best managed places in terms of the crisis, where the real crisis is, and our commitment to Acronis SAPA's safety, accessibility, privacy, authenticity, and security integrated in a single species, Acronis CyberProtect. And on that point, I wanted to talk about something which we also do as a part of Acronis Cyber Foundation. This is 2 gentlemen, which are friends of mine. They are alumni from the same university as me. Both of them are Nobel Prize winners in physics. One of them is actually in Singapore, and he got the Nobel Prize together with a gentleman on the right in 2010. He was one of the youngest Nobel Prize winners in the history. He's a professor here in Singapore. Another one is Sir Andre Geim. He's actually a Nobel Prize winner also in physics. And besides that, he's Ig Nobel Prize winner, which is a very special prize, which is given for the sort of most funny invention. So last time his invention was actually levitating a frog using intrinsic frog magnetism. It's not particularly useful to levitate a frog. Nevertheless, he's the only person who received both Nobel Prize and Ig Nobel Prize. So both the fun prize and not fun prize. And at the moment, Andre and Kostya are pushing this interesting method to fight the coronavirus, which I want to promote to everybody on this call. And this method is a hypothesis that many viruses can be killed by amphiphilic molecules, effectively molecules which are similar to soap. And so they actually destroy the membrane of the virus. So that's why when you wash your hands for a long enough time, you destroy the virus. In the country where I was born, in Soviet Union, they also recommended to wash your nose and to wash inserts of your nose with a soap a little bit to destroy your virus. Now, they propose to inhale these soap molecules. Well, now if you start inhaling soap, it might be a bit too stressful for your lungs. And, you know, who knows, people might start eating soap, but there are some better methods. And one of the methods is to basically do inhalation of things like green tea. Green tea has a lot of saponins molecule. I've actually bought an inhaler myself today, and well, actually yesterday, and I tried inhaling green tea. If you make a very strong green tea and you go through inhaler, it indeed has a lot of soap in it. It's a very soapy inside the inhaler. The idea is that this method destroys the molecules which just got into your mouth and into your higher respiratory act, kills those virus molecules, decreases the concentration, and perhaps kills all the molecules which can get into your body, and in such way prevents the infection, or at least it prevents the infection from becoming more widespread. And so what my friends, there's 2 Nobel Prize winners, one of them is was levitating a frog, which I think is very important in the content of this conversation, was suggesting that they want to recruit volunteers who will do this green tea inhalations every time they come from the outside. We intend to help them to release a mobile application to report health condition, and they want to compare the results of those who actually did green tea inhalation and those who didn't, to figure out if it actually helps to decrease the infection rate, especially in the places like Italy, where the first wave is mostly over, and also in the places like New York, where the first wave is also getting over. It's important not to get into second wave. A number of infected people outside will still be very high. And so the second wave can start anytime. If you remember, 2 months ago, there was very few people sick. Well, let's say we get over the second wave. It doesn't mean that number of infected people goes down to 0. So perhaps if you inhale green tea, it's not bad for your health. It will help you to not get sick. And so we will try to announce more about it. It's a serious call. It's a serious call by 2 people. You know, instead of being levitated like a frog, you might inhale green tea and never get sick. Thank you.
Thanks for that, Sergei. Interesting times, tremendous opportunity for our partners to actually help their customers through it. With that, I would like to introduce my estimable colleague, Candid Wuest. He's Acronis' Vice President for Cyber Protection Research, where he researches new threat trends and comprehensive protection methods. Previously, Candid worked for more than 16 years as the tech lead for Symantec's Global Security Response Team. He's published a book and many white papers, frequently cited as a security expert in Tier 1 media outlets. Candid's also a frequent speaker at security conferences like the RSA Conference and Area 41. He also serves as an advisor to the Swiss federal government on cyber risks. I'm going to hand the baton over to you, Candid.
Thank you, James, and welcome everyone from my side as well. So I'm definitely excited to talk about some of the tips, how you can work from home and still stay safe, right? Which, as we heard, is very important in those times at the moment. I mean, it's challenging times, and you might think, well, it's not really different, right? You had internet connection at home, you got your laptop, so what could possibly go wrong? But there are actually still a few fundamental differences between working in the office and working at home. And Sergei already discussed a few of those. So most companies cannot really afford to have a laptop for everyone, or they might just not have enough at stock at the moment. So we see that very often now, people are using private laptops which are not managed by IT. So the first question to ask yourself is, what actually happens if one of those devices breaks? Can you just go and buy a new one? Because in current situation, the supply actually is delayed. So you might have to wait for it, and a discussion who's going to pay for it, right? And at the office, you got hopefully an IT department managing your machines. So they will install the software, making sure that you're on the newest version, everything is patched. But at home, that's up to you, right? You are the administrator. So you need to make sure that all the software is updated. And then the question arises, do your kids actually use the same machine in the evening to do their homework? Maybe they're installing some games as well, or some application for school. Do you know that? Have you that under control? Another point to raise is the gateway security at the perimeter. And yes, of course, the old analogy of the medieval castle with a huge wall and some moat with, I don't know, crocodiles and venomous snakes is not really true anymore, because now we have very applications running in the cloud, so accessible from everywhere. But it still holds true to some extent, because in the office, your gateway security, like firewalls or intrusion prevention systems, will protect all the machines which are inside from at least some of the threats. At home, you're probably looking at a, well, maybe outdated router or Wi-Fi access point that you got from your broadband provider. And the question there is, when was the last time that you actually checked if you're using the default password? If there are some updates to be played into? And how secure is your Wi-Fi at all? Do you trust all the devices in your home? Maybe you're trusting your laptop because it's a work laptop. But have you checked your smart TV, your smart fridge, or your smart kettle? Those are essentially all workloads which have a computer inside, which could potentially attack you and then through your machine go into the corporate network. And the last one to point out is, of course, the storing of secure or sensitive information. In the corporate environment, you usually have some measurements like policies or data loss prevention tools, which can enable to control where the information flows. At home, you might download all the information and put it on a USB stick that you then forget, or you have it on your machine, but it's not really encrypted. So next time you actually take the laptop into the train and you forget it because of social distancing, you might lose all this information and make it available for everyone else, right? And to add on top of this, you also have the issues of connectivity. I mean, in the end, there's always some connectivity problems here and there. We see it when everyone's working at home at the moment, but those could also be an attack, like a distributed denial of service attack, where someone's deliberately trying to kick you out of that meeting, which is very important. So you can see there are a lot of questions that when working from home definitely should be answered, right? And need an answer in order to know, are you secure or not? So the question you could pose is the danger real? And do we actually see any of those attacks happening? And we already discussed a few of those, but if you look at the news outlet, there has been a huge spike because, of course, cybercriminals, they love pandemics. They love the COVID-19 crisis because they can play on the fear of the people. Now everyone is seeking information. So they want to learn about new things. And if they receive an email, which supposedly is coming from the World Health Organization or the CDC, and telling you, hey, here are some new stats for your country or the city you live in, you might be inclined to actually click on it, right? Or you might receive an email saying, hey, there's some new face masks available just next to you, and we have instant delivery, just come to this web shop. And that might be something you actually want to click on, even though you don't know the shop. Or as a last example, we have seen some emails floating around, supposedly coming from an airline telling you, here's the refund for the ticket for your next vacation that you booked, which unfortunately you will no longer be able to take. But of course, all of these examples are scams. You will end up on some fake website, some fake shop, which try to just steal your credentials like the password or your payment card details, or they might even try to install some malware like ransomware. And we actually seen in our Cyber Protection Operations Center, the CPOC, an increase of ransomware detections. At the end of February, we saw an increase of 7%, followed by another 10% increase in the first week of March. And this kind of highlights that the attackers, they don't shy away of attacking even now in those critical times. And the Interpol just recently released a warning that we see more and more attacks against health organizations, hospitals, medical workers. And unfortunately, we can confirm this. One of the reasons is those people are, of course, under a lot of stress at the moment. So if you are a doctor working 30 hours straight and you receive an email, you might just accidentally click on the attachment because you're just not in your normal health state, right? On the other hand, if a ransomware attack actually managed to bring down a hospital, that will be very crucial, right? Because that means people might die. So hospitals, they cannot allow to be down for 2 or 3 days, maybe negotiate and see if their business plan actually works out, if they have a backup, if they can do disaster recovery. They need access to the information as soon as possible, which means they might be more inclined to pay for it. And unfortunately, we have seen many attackers at the moment earning millions just by exploiting this situation. And last but not least, we probably should also talk about Zoom, Skype, WebEx, and all those video conferencing systems which are heavily used at the moment. And Sergei already mentioned that we have seen that besides the usual privacy issues, which are of course concerning as well, there have been some exploits. For example, in Zoom, if you receive a link in the chat, this can lead to your password of the Windows computer being leaked to the attacker, and then they might be able to take over your account or your machine. Whereas on the other hand, for Macintosh, we have seen some attacks where they actually were able to remotely control your microphone and your webcam, which of course is something you don't really want to have as well. And we could probably go on for hours with more and more, but I wanted to give you 15 actionable tips on what you can do at home to be more protected. So what you should do is check your Wi-Fi router at home. Make sure that you have changed your default password. Maybe check if there's some firmware update and if you can do some configuration as well. And while you're at it, maybe change the Wi-Fi password as well, unless you really want to provide free Wi-Fi for all your neighbors as well. Ensure that all your connection you're doing to the office or to cloud services are secure. Usually that's done through a virtual private network, through a VPN. And of course, lock your PC once you finish the work and once you do no longer require it. And I know this might sound silly or even paranoid, specifically if you're home alone like me at the moment, but it's about getting into the right mindset. If you do it at the moment, then you actually will do it as well in those situations where it's critical, where otherwise you're just gonna forget about it because never trained for it in the right mind. And to help you with this, of course, the Acronis Cyber Protect solution can help you to ensure that you have secure connections. And in addition to that, we can also help with protecting against sophisticated malware threats like ransomware. So there's a full security software built in, which can protect you with artificial intelligence and behavior-based detection against all those threats which are currently knocking at your PC and workloads. It will also automatically check for any vulnerable software that you might have installed and give you an ability to patch those to the newest level, which will remove any of those vulnerabilities that could be exploited. And it can also be expanded to all the other machines inside your environment to ensure that none of those machines will use your laptop as a pivoting or stepping stone into the corporate network. And again, of course, Acronis Cyber Protect solution can help you with all of those points. The next point you should definitely address are, of course, passwords. And that's not just because of the pandemic, it has been before as well. Use strong passwords and use unique passwords for all the different accounts. So one password for each account. If you can't remember all of those, and I can't remember thousands of passwords, use a password manager to help you with this. And wherever possible, use two-factor authentication. So those are those passwords or tokens that you receive by text message or mobile phone apps, which change a token every 30 seconds. And those can be used to make it harder for an attacker if they successfully use the phishing email to actually get your password. They might not be able to use it further because the two-factor authentication is out of their hand. So of course, Acronis Cyber Protect can help you by blocking you from going to those phishing websites in the first place, preventing you from entering any of your passwords or credit cards to any of those malicious websites. We already talked about protecting Zoom, WebEx, Skype, and so on. So make sure that you check out the configuration, that you actually set a password for all the internal meetings, that you make sure that only you can share information and not anyone can join in, because otherwise it might not be secure. And this might sound a bit strange because we're currently hosting it in a Zoom meeting here, right? This whole conference, but you can actually configure it that there is not a chance of someone else Zoom bombing and pretending to be you and maybe showing something that you do not want to. Also make sure that you're not mixing your work with actually your kids working on the same account. So use different accounts or even different workloads if possible. And please do not overshare data on social media. Yes, I know it's funny if you can have a video of your colleague's cat jumping into the meeting camera and kind of doing something funny and kind of embarrassing everyone. But if you post that to Instagram, there's a high chance that you actually reveal the information about the meeting location. And maybe next day, it's more than just a cat invading your meeting. And that's definitely something that you do not want to have for good productivity. And last but not least, it's all about data and privacy. So make sure you have to back up all your information, at least daily, maybe even more frequent if you update some important documents. If you store them locally, encrypt the full workload, or maybe have an ability to remotely wipe it, like many smartphones have. Apply this to laptops and computers as well. And very important, use a secure application to actually share data, to collaborate. And this, of course, can be done through the Acronis File Advanced or Cyberfile Cloud, which offers a secure way to share information, share data inside your organization, but also with external people. So there are a few tips. If you are more on the business side, as in inside an organization, then of course you should also make sure that you have a minimal security policy for all the laptops and workloads connecting to your infrastructure. So make sure they have a security software. Make sure that you check that before they actually connect to the VPN or put them in a separated network. Minimize the timeouts, for example, on VPN, because a lot of people forget to log out in the evening. So the whole connection will stay online during the night. And that's just using up your bandwidth and probably your licenses as well. And as I mentioned, give your employee a possibility to work safely. So make sure that you actually have a sanctioned central application for sharing all those files. Otherwise, they just will start using maybe Google Cloud or Dropbox, because if you're not offering them something, they will come up with a solution that works for them. So as we demonstrated, it's more than just backup or more than just antivirus that you need. And Sergei already mentioned, we follow the SAPAS approach where we go over safety, accessibility, privacy, authenticity, and security. And this is, of course, mission critical when you work from home. If you cannot access your data or if it's not available, you will not be able to work. If your data might be shared with someone else or might have been tampered by someone, well, you might still be able to work, but you might not have a job tomorrow because that's a definitely big data breach. And if you have some virus or ransomware on your machine, that's not going to help either with productivity. So in addition to the points that are already raised, I wanted to give a few additional features that the Acronis Cyber Protect solution actually offers to help you with the work from home. I'm just going to pick a few and not going to read all of you, but maybe the remote desktop access is something interesting for Windows and for Mac users, for administrators, but also for end users at home. So if you have forgotten something on the machine which is at the office, you can simply use this to remotely connect to the machine and collect the files or do some work without the need of a VPN or some additional software being installed. On the other hand, we also provide a VPN with the disaster recovery option. So there is the opportunity to connect to those internal machines if needed. And of course, if you cannot handle them yourself, then, well, we can offer consulting services which help you to demonstrate what you should do. And again, if you want to know more, please reach out to us and we're happy to tell you more about it. So as you can see, there are definitely quite a few digital risks linked to the COVID-19 pandemic, but with partners like Acronis, you can definitely efficiently protect yourself at home and stay cyber fit. And with this, back to you, James.
Candid, thank you so much for that presentation. A ton of great practical advice, actionable advice to take there. All right, at this time, I'd like to invite our previous speakers, Sergei and Dr. Rappuoli, back for a few questions from the audience again. Once again, audience, if we don't get to everything that you asked today, we will follow up with you. But in the meantime, let me start with a question for Dr. Rappuoli. Does the warm weather affect the virus? Will the warm spring make it go away faster? Oh, looks like we've lost the doctor. Let me go over to Sergei here. Question from the audience: how can the IT industry help?
We've lost a lot of doctors. That's one of the problems. Some of them are getting lost because of the biohazard, which is a virus. Some of them are getting lost because they have cyber virus, because the doctor without a computer today is not a doctor. But Dr. Rappuoli was just busy, so he couldn't wait that long. He will answer his questions over email. So keep asking the audience. We will provide the answers, just not immediately right now. Somebody has to work on the vaccine. James, go on.
Thank you, Sergei. So this one's for you. How can the IT industry help small and medium businesses who are facing closure due to the pandemic?
Well, what do you mean? Like, I think we actually try to help in the ways we can. So there is really three things we can do. So one of them is to provide cyber protection and cyber cloud, which allows partners to make money and allows customers to be protected and focus on making money and focus on their health. So either to make money or to save time, this is a sense which we can do for you. This is our expertise, and we're going to continue to focus on it. It's incredibly important. Now, the second thing we are doing, we are focusing on education and knowledge. We are trying to spread more information about how to fight the virus. It's interesting, but we grew up in these situations where we believe that our families, our governments, our companies will take care of us. And actually, the pandemic like this shows that in many cases, you need to stand up as a company, as a group of people, as a partners, and do things yourself to help yourself. And one of the things you can do is to learn more about the pandemic, but also about how to organize your remote workplace, how to organize your remote workplace for certain type of business activity, how to protect your remote workplace, how to help other people to be protected. So that's the second thing. And the third thing is a minor thing, but we have in many markets, especially in the United States, included partnerships with companies which help to find small business debt to help your virus to help your business, to help your business to go through this time with cash. Because again, one of the most important challenges right now, it's not the virus, but it's a cash flow. The lack of cash flow, not the presence of the virus, that is a danger for your business.
Thank you for that. Candid, I think this is one for you. I read that some hackers claimed that they wouldn't target hospitals with ransomware during the crisis. Is that true?
Well, it's true that they claimed it. So some groups like Mace or Doppelpaymer, they claimed that, but unfortunately there is no ethic with cyber criminals, right? So we have already seen again attackers doing ransomware attacks against biological companies, for example, in California and in Texas. And so there's unfortunately not much truth in it, beside that they claimed they do it, but they never intended to hold up that bargain.
Thank you for that, Candid. Sergei, let me throw this one to you. Why are so many companies struggling with work from home? I mean, we've had bring your own device and cloud forever. Shouldn't this be already familiar? Nothing new?
Well, I mean, depends on the business, right? I mean, for example, telemedicine is something which people talked about, but it's just an example of the industry which on paper is supposed to do well, healthcare. But practically anything which is outside of anything requiring hospitalization and anything related directly to the virus or similar to the virus, the COVID-19 virus, is struggling, because how can you go to a dentist if you cannot go to a dentist? Can you really cure your teeth over the internet? And there's a lot of other businesses like this. Then, of course, for some companies which deal with not services and not physical goods, but virtual goods like entertainment, like software, like internet services. Working remotely is normal. In our industry, there are many companies which are 100% remote, but in many other industries, that's not the case, and so people have to learn. And many professions now can be switched to remote. For example, if you look at the manufacturing industry, which is another industry which is in trouble now, because if you need people in the factory floor, you cannot get them. And even when the quarantine will stop, it's unlikely that it will immediately allow hundreds of people or thousands of people in the same room, right? You might get to a situation where you can get 50 people or 100 people in the same office in the different rooms. And so it takes time to be able to reconfigure it for remote work. That's just the current answer. I'm not sure whether it's very interesting, but it's just so many industries are physical. We were moving towards the sort of flip side from this question is that this situation is unique in a way that most of the time when you had a real estate crisis in 2008, or you had a 9/11 in 2001 and previous economic crises, the effects were not so persistent. So people would be going through a crisis, and then it will be coming back. So I think in the current situation, a lot of the things will not come back. A lot of the businesses will stay remote, and for many businesses which were requiring physical presence, the physical presence will not be the same anymore. And so learning how to work remote is especially important because it's again, it's a challenge, but it's also an opportunity. And there is no way, even in case this situation will finish in 3 months, there will be 10 times more people working remote, and there will be many businesses which will have less physical presence.
Thank you for that. Candid, this one looks like it's for you. I think you answered this a little bit in your presentation, but maybe you could give it some more color. What type of cyber attacks saw the largest increases during the crisis? Was it ransomware, phishing? What should I be most worried about helping protect my customers against?
Well, I guess in the end, you should protect against all of those attacks, right? Because just having one which is succeeding can already bring down your business. But to be more specific, we definitely seen a huge increase of phishing emails and scam emails, because those are just the easiest way to actually get to the end customer at the moment. So it's about 2/3, even 3 out of 4 attacks are conducted by emails. So you receive something which might have a malicious attachment, like those funny Word documents with a malicious macro that you need to enable, or it might be a link going to a phishing website or a malicious website. So those are the most prominent ones that we've seen. But as I mentioned, we also see a huge increase of ransomware attack, just week by week, about 10% increase at the beginning of March, showing that it's just so profitable for those attack groups. For example, the FBI expects that the Ryuk ransomware group makes about $3 million per month just by holding your data hostage or threatening to release your information to the public. And we're not just talking about huge organization like the energy provider in Portugal who announced that they were hit this week, but also small and medium-sized companies are of course in the crosshair of the attackers. So all of those should definitely be protected. But as we learned with attacks against Zoom, even a weak password or no password for some Zoom conference can be enough for an attacker to attract the attention to you, and then you have to deal with the consequences.
All right, I'll say thank you very much to our speakers. That's about all the time we have for panel discussion today. I'd like to wrap up with just a few closing remarks, point you to a web page that Acronis has put together with a lot of resources that I think you'll find very interesting. That video interview with channel expert Larry Walsh is a particular interest to our partners, I think, but you can keep coming back to this page for more information about how Acronis is responding to the pandemic and how you can take advantage of that information. I'd also like to point you to a few programs that we've put in place to support our partners in helping their customers through the crisis. We're offering complimentary access to Acronis Cyber Files Cloud. Again, as we've mentioned, that's our secure file sync and share solution. Also, free consumption for new customers on Acronis Cyber Backup Cloud through the end of July. And we're also offering Acronis Cyber Protect for the same price as Acronis Cyber Backup. So when you get Cyber Backup, you can also offer Cyber Protect at the same price. Again, we're offering these through the end of July to help customers get through the crisis near term. With that, I'll say thank you all so much for your time and attention today. We will follow up with questions. We will send you a link to the recording. We hope you'll come back again soon for future virtual conferences that we're doing on how to stay cyber fit. With that, I'll say thanks again, ladies and gentlemen. Be well, be safe, be secure. Good day and good evening.